In our last session, we discussed how to properly reconcile medications pulled on override from the cabinet and matching them to an order. And in that lesson, we entered an order. This lesson is about other things you can do with entering orders, modifying, and discontinuing them. As you can see, I'm currently logged into the system, and I'm looking at the chart of a patient whose name is Rachel Castle. And I have accessed the Manage Orders screen, this tab on the left-hand side. And the default tab in the Manage Orders screen is the Active tab, and this is going to show me all active orders for the patient. So in my first scenario, I'm going to describe what we'll do when we have a telephone conversation with a provider who is not at the facility but needs some of their orders updated. First, I'm going to show you how to modify an existing order. I'm going to scroll down to the continuous section where I find all of my infusions. One of my currently active infusion orders is for lactated ringers. It's my maintenance fluid. The providers stated that they want to change the rate up from 125 to 150 mils per hour. So in the middle of my screen next to each order is a Modify button. I'm going to click Modify. I'm on the phone with Dr. Mountain, and he is instructing me to up the rate of this infusion. In my dose field, what I have currently active is the 125 mils per hour selected. So looking at the screen, you might be under the impression that that's the maximum that you can order. This is a common misconception. These buttons are not a limitation on your choices. They're simply the most common doses that we will find. But in the left-hand side, I'm going to update it to 150. This is going to be a continuous order for the patient. We're not going to change frequency or anything else. So I'm going to click on Accept. And you can see the modification that I just entered is sitting in my ordering sort of shopping cart on the right-hand side, waiting for me to sign. But I'm going to make some other changes before I sign. I only have to sign once when all my changes are in. I'm going to take the example now of my PRN albuterol nebulizer solution. This order just a couple clicks down from my lactated ringers. This one I'm going to discontinue. Patient's not responding to this medication, so I will simply hover over the discontinue button, click it one time, and you can see that action in red is queued up now as well on the right-hand side. The doctor has also asked me to update the patient's diet. I'm going to scroll down to the diet section of this active tab, and here I see NPO. I'm going to take my NPO diet order and I'm going to replace it with a regular adult diet. Now you might think that here I would modify, but what I'm going to do instead is enter a new diet order. So once again, on the right hand side of my screen there is a search field that says place new orders. I'm just going to type regular diet and tap the enter key. And there it is, my regular healthy diet. Notice there is at least one default setting of effective now, but I can change that if I need to. I'm going to double click on this order, and there it is sitting on the right hand side in green, new orders, regular healthy diet. But I'm going to change a couple of the parameters of this order before I sign it and make it active. So I hover my mouse pointer over it, I click one time, and notice in the frequency field the default is effective now, but actually we're going to make this effective at midnight tonight. So I just changed that setting by clicking effective midnight. And now I see a starting time of 1 minute past midnight, tomorrow's date, if today is 8/6. You can see there are other modifiers here available to me, but I'm going to leave all of that blank for now. If there were additional modifiers, you could use this magnifying glass to search for whatever it is we need to add. So for example, I'll say low potassium. I don't know if that's clinically appropriate, but I highlight that and I click accept. Accept one more time when I'm done modifying this order. Now I'm going to click sign, and since I am not a medical doctor, I need a co-signature of the provider who gave me the order. So the screen is now asking me what my order mode is. In other words, how did I receive this order? There's a few pre-built options in the magnifying glass drop-down menu. This one was a telephone conversation with the doctor. Now I'll stop right here and mention best practices. Our best practices with telephone orders are to keep the doctor on the telephone as we go through this signing process, and I'll tell you why in a second. Remember, my ordering provider was Dr. Mountain. The nice thing is, when I go searching for that provider, I have my treatment team filter turned on, which means I'm only going to find clinicians who are actively on this patient's care team. So I click my magnifying glass, and there's the attending Dr. Mountain. The system will think for a moment, and it adds Dr. Mountain as the ordering provider and also the authorizing provider because he is the attending. When I'm done, I can click on Accept, and these orders will become active. Some safety checks run in the background, and if the patient had any counterindications for any of these medications, I would see a warning screen right now, such as the patient is allergic to something. And the last thing I'm going to do, these orders are active, so I should find them in my active tab. Number one, there's my 150 ml, my new rate for my lactated ringers. I'm going to scroll also down to the diet. Now notice, I have 2 diet orders, which is strange, but remember, this diet is effective at midnight. At midnight, this NPO diet will automatically be discontinued. So that's entering, modifying, and discontinuing orders.